Hello, everybody. Thanks for joining us. I'm Courtney Snow, and today we have a couple special guests. In the middle, we've got Michelle Smith, and then on the right, we got Sarah O'Neill. Both are certified child life specialists at Shriners Children's Ohio, and we're just going to talk a little bit about what they do. So, do each of you want to introduce yourselves?
Sure. I'm Michelle. I've been a child life specialist at Shriners. This is wrapping up my 22nd year, creeping in on my 23rd anniversary. So clearly a place I like. I've been there a long time.
And I'm Sarah O'Neill. I've been at Shriners for almost 11 years, the end of the summer. So we've both been there for quite some time, worked together for quite some time, and really obviously enjoy where we're at.
Awesome. Well, we have a couple questions for you just so parents in the community can find out a little bit more about what you do and how that ties into the services there at Shriners. So, what exactly are child life specialists? What does that mean?
Yeah, so it's kind of one of those things that's hard to describe when you've never worked with one of us. But in general, we are part of the psychosocial care team, usually in medical settings, but sometimes also in community settings, to help kind of provide emotional and psychosocial support to kids and families during their healthcare experience. So we can really try to provide an experience that is as least stressful as possible, providing that support, diversion, education, preparation to help them get through what they're getting through with the least amount of stress and effect on their development as possible.
Awesome. Is there a time that you can think of that was one that like meant the most to you all?
Oh gosh,
So many.
there are so many, but I think just getting anytime we get feedback from someone, just saying what a difference it made, or I didn't know I needed you until you were there, and what a difference it made. I didn't know it could have gone this well. I didn't know we could have gotten through that, or whether it's the child we're working with or the parent just in shock that I can't even believe my child just did that, and it wasn't a huge mountain of an obstacle. Like, we got through that smooth sailing, and anytime we get that feedback, I think it just reinforces that's why we're here and the difference we can make. So
That's awesome. Yeah, 'cause there can be some, there's a little fear sometimes of hospitals, even for the parents, if they'd gone through something previously. So, yeah, it's good that you guys are there to support the kids and the parents.
For sure.
Let's see. So, how does that role work at Shriners Children's Ohio?
So Sarah and I, now child life can function differently in different settings, but at Shriners, we see kids in all of our service areas, which is our outpatient clinic. Um, Most of our patients that come to Shriners are going to be seen in the clinic. Most of the injuries and conditions can be treated on an outpatient basis. So that's where we'll contact the most people, and the coming to our hospital, but we're also in the surgery department and in the inpatient setting, and then we're working hands-on really closely with our outpatients as well as they transition back, or they're in an extended treatment plan on an outpatient basis. So we're seeing kids everywhere in that support role.
Yeah. If you want to go into a little bit more, like in all of those areas, each area looks a little bit different. Because there are different settings, there's different things going on, things like that. But in all those areas, we're really looking to build a trusting rapport with the kid and the family. That's the first thing when we meet somebody that we're working on, is just getting them comfortable with us, with the environment, and kind of making sure that they realize that we're a support person for them during the whole experience. We're constantly assessing their development, what their understanding of their experiences, what maybe past experiences they've had, how they cope with things, any fears that they might have or any triggers that they might have. We really work to prepare them for what to expect. So if we know there's a dressing change coming up, we'll work with the nurses to make sure we know exactly what areas we're working on, what order we're doing things in, so that we can prepare the family and the patient for that. We also provide a lot of kind of what we would consider like an indirect diversion, making sure that they have things to do kind of in those waiting periods, things to play with, things to keep them busy so they're not sitting there twiddling their thumbs working themselves up. We do a lot of direct procedure support, so helping them get through those procedures, helping them with diversional play. Some kids do great and we can play with bubbles and we can play with sensory toys and other things. Some of the teenagers might do well with just discussions and communication and conversation. It just really looks different from kid to kid. Sometimes it's just a matter of having a comforting hand to squeeze, comforting presence, somebody talking, whispering in their ears. We do a lot of processing afterwards as well, celebrating their success and kind of preparing for what comes next.
That's awesome. Um, so both of you are part of a larger care team for the patient. You kind of tied into that. Do you want to expound upon any more about how that works?
Yeah, like Sarah said, in the clinic, we are, well, in general, we're working with the whole team. We're planning with the nurse or the therapist, like what's going to happen so that we can properly prepare for it. In the inpatient setting, our multidisciplinary role is even larger. We meet often, we do a lot of planning and tweaking the treatment plan, information sharing, and advocacy for our patients to make sure they're in a setting and approached by the whole team in a way that's in line with their development and their background, and meeting them where they're at to set them up for success the whole time they're with us, whether that's just for the day or many months through a long-term hospitalization. We're making sure that the families have information along the way in a way that they understand it, and we're helping them to guide their child. Sometimes most of the time we're working directly with the child, but you can't do that without bringing the whole family into it. But we co-treat with our physical and occupational therapists to help kids get through their goals in that discipline, and the dressing changes, meeting with the doctors, coming in for surgery, do a lot of medical play, and just bringing the whole team into it to really have some continuity with our patient, that they're being, like I said, met where they're at when they're coming to us, supporting them when they're there.
That's awesome. So again, you did touch on this a little bit already, but because it's not just the patients you interact with, how do you engage with parents, the caregivers? Can you go into a little bit more about that side of it?
Yeah, so we do a lot of preparation work and support for the parents as well. Some kids do best with their parent as their support person. Often kids, that's the case, or oftentimes that's the case. So a lot of times we're prepping them, kind of giving them some of those tools of how to guide their child through what's going on. Oftentimes we're supporting the kid, but with the parent between us and the kid. So we're kind of giving the parents those tips of saying, hey, why don't you try this? Or you're doing great, keep doing it, giving them kind of that empowerment to be able to get through it. Like you said before, like sometimes those parents have anxieties themselves with coming into these experiences, and they just need a little bit of like somebody in the background giving them a little bit of comfort. So we work that way. We also make sure that they're getting all of the information that they need. We check in with them regularly to make sure they have their questions met before surgery, to make sure that there's no needs that they have or their families have while they're staying with us or while they're there for surgery or there for clinic. We also really try to empower them as the expert on their child. So like the doctors are the expert in the medical care, right? But the parent really knows their kid best, more than any of us ever could even dream of knowing them. And so we really want to kind of help build them up and empower them to speak up for their kid, give them the right words to speak with their child or their teen even about what's going on, and just giving them a place in the team. They are part of our team and our family-centered care.
Yeah, that's good because I mean, I hear it a lot. It was something I had to learn when my daughter was young. That you think because you're going into a setting where the doctors, they are the experts in the medical field, and is it okay to speak up? Like, you don't want to offend them, and like a lot of parents go through that. So that's really good that you help them make sure they have that voice and not feel intimidated, like I know a lot are. Um, any kind of doctor or medical visit can be scary, as we said. What are some of those things that you suggest to parents, maybe beforehand or when they first get there? What are some insights you have?
So, to echo what we've been saying, making sure that kids and parents have the information is the biggest key. We know, and the research shows that having the knowledge, the tools, and skills to prepare and support kids through their medical procedures is key. And so that is a big part, just that they know what they're coming into and what's going to happen, and that empowerment with the skills. So if you know, as a parent, if you know ahead of time, okay, we're heading to the doctors for a checkup, what's going to happen there? Well, that's second nature for an adult if you've been through it so many times, but a young child, at their different stages of development, are taking in that experience differently. So running through ahead of time, like, hey, we're going in, and this is what they're going to do there. One of the top fears, even of many adults, I think it's like 25% of adults still, and half the teens and more than half of kids worry about needle pokes. So that's a key thing. Let's clear that up ahead of time and talk about it. To be honest, we've had families come in on surgery day and say, "Oh, don't talk to my kid about what's happening. I told them we're going to Walmart. I told them we're going to go out to eat.
McDonald's, to a
We're
water
going to
park.
do paperwork, and we're going to go somewhere wonderful." And that's a difficult place to start from. As Sarah mentioned, one of the first things we're doing is building that trusting rapport. So a key to that is just being honest up front. And that can be hard because we're often with medical experiences talking about scary things or things we think could be scary, but kids are amazing, and if you can talk to them and come from a place of feeling confident about it, using language that frames things in more of a positive, matter-of-fact way, not dramatizing, like, oh my gosh, you're gonna get, it's the worst. This one time I had to have a shot, or I had to have a dressing change, and it was the worst thing I've ever been through, and I was held down. And, that doesn't help anything. To just talk, well, this might happen, or this is probably going to happen, and if it does, we'll make sure you know what's happening, and give some choices about, oh, okay, if, like I gave the example of the needle poke, if we have to get a shot today, that's an important thing to happen. The doctor needs to do that to make sure that you're healthy or keep you healthy. That's important. We all want that. So, okay, do you want to sit on my lap? Do you want to sit on the table? Who do you want next to you? Do you want to bring something you can hold on to? Something to snuggle. So giving some choices and empowerment, and just talking about it in a way to set them up for success. Language and that preparation are two big factors for success.
Yeah, for sure. Yeah, I think one of the other things too that I always see, kids are often told, like, oh, you don't need to cry, this isn't anything to cry about, or you got to be really strong, and we don't want to tell them not to cry. We don't want to minimize their feelings, their experiences, and we don't want them to feel like that's not accepted. So we want to say, like, sometimes I'll even say, tell kids, like, and sometimes even teenage boys, older kids, like, it's okay to cry. Like, this is really hard, or it's okay if you're scared to cry. We're going to help you through it. And really kind of not giving that, like, unintended label of those feelings are bad, or that they're not strong, or that they're weak. And we oftentimes, if a kid's crying, there's a reason they're crying. They don't just cry because they want to, right? So oftentimes it's like, oh, you don't need to be crying about that. Like, sometimes we can get them to work through things and talk through it and process the specific event, but there's some underlying reason that they have started crying. So that's a big one that we see. And then really just praising kind of how they're doing, like giving them constant reassurance, like you're doing such a good job, like you're doing great, focusing on kind of the positive sensations instead of the things that don't feel good. Like if they are getting a shot, like, and they're getting a hug from you, like, doesn't it feel so good to be hugging you? Or doesn't it, like, can you feel like my heartbeat, or can you feel the warmth coming through, like, between us, like, and kind of focusing on that and drawing away from the negative things that are happening can really help kind of shift their focus into a positive channel rather than looking at the negatives.
I think that's really powerful.
Yeah.
To go a little further with language, something that we hear often from parents is telling a kid, I'm so sorry you have to do this, or, mommy's so sorry. But we use an apology when something bad has happened or we've done something wrong, which really isn't the case with medical care. We're not doing something bad. It's something difficult at times, but it's not bad, and we didn't do anything wrong. And even just that subtlety of not apologizing for it, rather validate, yeah, I know this is hard, we don't do this all the time, and like Sarah said, praising the positive efforts, and look how still you're being, even though this is scary. Oh, I can see you're taking those deep breaths. Even that kids pick up on that language. So I think that's a big one we see and recommend, if you can avoid doing that.
Yeah.
And then our other thing we hear sometimes, like, that nurse is being so mean. Sorry, they're being so mean to you. I'm going to make her go away. And she's just a big meanie, and that maybe feels good, like you're rescuing your child when it's all said and done, but medical care and interactions are lifelong, so it may help in the moment, just like maybe holding them still, or holding people's tendencies, just hold the kid down, that maybe aren't more in tune with pediatric care, but those types of things are just damaging for future experiences. Those are some of those things that we as adults might bring the fear into when we're taking our children and ourselves, because we're remembering experiences like that. So we don't want to perpetuate a negative relationship with the healthcare setting. So we don't want to blame the nurse or the doctor, or shift that to fracture the trust. Go more toward the empowerment of those comfort positions, and those encouraging words, framing things in a really positive and heroic, successful, brave manner.
For sure.
Yeah.
We've kind of alluded to it a couple of times, but I think it's easy to assume as the child gets older that stuff's just naturally going to get easier. And it's not always the case. So we really, and even sometimes like parents, other staff, like, oh, he's 16, he's 17, she's 18, like, they don't need you, like, they'll be fine. But it's really important to prepare and support them too. Like, we're never really going to outgrow having a comforting presence of somebody that we trust, right? Like, so with having a parent, like, how many teenagers I've seen reach for their parent's hand to squeeze, and having that comfort and that presence never gets old, and it's really important to give the teens an opportunity to learn what's going to happen, but also ask questions ahead of time, so that they're not just thrown into it without having any information. And really, it gives you an opportunity to allow them to do some self-advocacy and speaking up for themselves as well, and making those choices and asking for things to be the way they want to be, rather than you always having to speak for them. So kind of developing that, preparing them for when they are going to be there by themselves as an adult, right? Like, helping set them up for how to interact in these situations so they can be successful as an adult. And I think, kind of going way back to the beginning of it, like, I think it's really easy for parents to get anxious for their kid, right? And that, unfortunately, kids and teens can feed off of that. So, like, doing your best to stay calm calming yourself, preparing yourself so that you can be calm and relaxed for your kids to feed off of that. And the more calm and relaxed and at ease you can be, even if you're not feeling it on the inside, showing it on the outside really makes a difference for how the kids react as well.
Yeah.
And I think staying empowered. You said yourself, like, it can be uncomfortable. Like, am I allowed to speak up? I don't really like what's happening, or I'm not really sure what's happening. But they seem like they're really, pressed for time and moving quickly, and we've got to just stay on track. But take that time, take a deep breath, slow yourself, and make sure you feel like you have all the information and you're comfortable. If you're leading up to something ahead of time, call or send that MyChart message like, hey, give me a little more info about what this is going to be like when we get there. Or ask, what resources do you have? I want the team to know this about my child and what is scary for them and what's not. Do that. Call ahead. Make that early contact. But if you can't, or you haven't done that in the moment, take that time. Go ahead. Advocate. Ask questions. And there's resources out there for you if you want to learn more about. We've mentioned like a comfort position for care. We use it a lot for dressing changes or needle pokes. Positioning that child in a way that the medical team can have access to what they need, but the child is feeling very safe. They're not vulnerable laying on their back. And they're feeling comforted by their parent or another person. Sometimes that's us, so someone they have rapport with. We're safe people. We're not ever doing the owie things in the room. But just yes, you're on the part of the care team as a parent, and you have a voice in that, and go right ahead and speak up. And if you're not welcome to do that in the facility or with the provider you're with, then that might be something that's important for you to maybe we need to find someone else where we are valued as a part of the care team.
Yeah. When families go to Shriners specifically, is your services just available? Do parents have to ask for it? Are you just kind of on standby? How does that work for families that are going there?
So for Shriners specifically, we are kind of a given, so to speak, in our same-day surgery area and our inpatient. So we are always prepared to see each surgery patient before they go to surgery and each inpatient as they need. The outpatient clinic is kind of more on an as-needed basis. There's just so many kids there and there's only 2 of us. So we can't be there for every single patient just waiting, but we are available for every patient if they're needed. So at that point, like, it's just a matter of the parent speaking up and saying, hey, is there a child life specialist that can come and help? Is there anybody else that can be supportive? Sometimes it's the nurse that calls and says, hey, I just saw this kid in the waiting room and they're really anxious. Can you come prep them and help get into the clinic so that they're coming in a good place rather than coming in fearful? So it really depends kind of on where you're at. And even in the same day area and inpatient area, even though we're planning to see them, if there's a time that they need us when we're not there, they're always more than able to ask. And our staff is more than willing to find where we're at and ask for our help.
Awesome. Yeah. I wish I'd had ladies like you when my first hospital experience was when I was 17, and I got diagnosed with type 1 diabetes. I ended up in the hospital and was like in pretty bad shape, but I never had needle pricks that I remembered, because it's been so long. And they gave me a very pregnant woman to come and put an IV in. And I was like, I can't hit you, you're pregnant. And she was like, that's why they sent me.
Oh goodness.
But I was like in there, my parents like weren't in the room with me. Like, I just remember being like pretty traumatic and like trying to have to work through that as an adult. And then when I had my daughter, it was a very traumatic experience, like trying to find ways to not pass on that like stress and anxiety to my daughter, which she's a teenager now. She's almost 15. But I think the points that you've given just in general, whether you're going to Shriners or just in regular medical care, I think is amazing. And I'm sure a lot of parents can benefit from that. So I really appreciate you taking the time to share all this with us.
Of course, it's been our pleasure.
And we know what a difference it makes. That's why we've been doing what we're doing for so long.
Yeah.
That we love to talk about it and share it and spread the word. And even if you're somewhere without child life services, as you heard, there are things that you can do just to be empowered. There are resources out there, and you got it. You've got this.
Yeah. Well, hopefully we might be able to get some links for some of those resources that you recommend most that we could put into, the description of the video and make sure parents could tap into that as well. So that would be awesome if you're willing to.
Yeah, we'd be happy to do that.
Yay. Well, thank you again very, very much. Really grateful to get the chance to spend time with you and share all of this. And, we'll keep on staying positive.
Thank you.
Thank you for your time.
All right, thanks. Thanks so much for tuning in. If you like this content, make sure to click the like button, share with a friend, and hit the bell to subscribe and be notified when we have new stuff to share. Doesn't cost anything, so why not? Scan the QR code to be taken to our site and see all the new stuff that we put out every week.